Hello, I am sorry that I can't be there with you in person, but I am grateful for the opportunity to join you for today's event on vertical integration in healthcare. I want to start by thanking everyone at Caper and Brown University School of Public Health for your powerfully important work. Research is key to my work in Congress, fighting for a more competitive and equitable healthcare system. Your insights are helping to shape healthier futures for families all across our country. One of the toughest fights ahead of us is the growing power of monopolies in healthcare. Part of that is hospitals becoming bigger hospitals and PBMs becoming bigger PBMs. But we're also seeing more insurance companies gobbling up physician practices and more PBMs snatching up pharmacies. In other words, we've got a system where too many companies are operating on both sides of the healthcare transaction. It is a gross conflict of interest, and the longer we allow these companies to control every link in our healthcare system, providers, PBMs, pharmacies, insurers, the more families are going to be priced out of life-saving care. Look, I know I don't need to convince this group, but if we're going to stop pharmacy benefit managers and giant insurers from jacking up prices on patients, from overcharging our government, and from squashing competition, then we've got to start by laying out the problem front and center. So, how do we stop them? Well, first, I have a bipartisan bill with Senator Josh Hawley and Representatives Diana Harshbarger and Jake Auchincloss to break up PBMs that own their own pharmacies and to untangle the corporate healthcare giants that are destroying our healthcare. Second, my Corporate Crimes Against Healthcare Act will stop private equity from squeezing our hospitals, our doctors' offices, and our nursing homes for every last penny. What we saw most recently with Steward in Massachusetts. And lastly, we need CMS to crack down on abusive practices in Medicare Advantage that let these giant insurance companies shovel more taxpayer dollars into related companies, possibly violating federal requirements. And we need the Federal Trade Commission and the Justice Department to step up and get serious about reviewing mergers in the healthcare industry. Competition is the best way to lower costs and improve care for patients. So yeah, these are bold proposals, but this is a righteous fight. And the time for tinkering around the edges in healthcare is gone. We need to stand up for patients and be honest about the problems in our healthcare system, and that is where your work comes in. This moment demands fearless research. In a moment where we're seeing reckless attacks on science and basic research, your work is that much more important. So I am grateful for your partnership and for your commitment to healthcare that works for everyone, and I will keep fighting for you in Washington. And I just want to say one more time, thank you again for having me. It is an honor to fight alongside you.